بودكاست مياسين سيكون رفيقكم الأقرب، حيث يخاطب القلب والعقل معاً، مقدماً قصصاً واقعية تعكس تجارب حقيقية وملهمة، تلهم أبناؤنا نحو الإبداع والتميز.
Welcome to Mayaseen podcast, the place where we open up windows of awareness and learn how to understand ourselves and others more deeply. This is your host, student Ayes Salim from grade 5, class 5B. Our episode today discusses a very important topic: child psychiatry and children's mental health. Today we are honored to welcome Dr.Mohammed Al-shamikh, who will help us understand these topics clearly and simply. Welcome, Dr. Mohammed. We often hear terms such as psychiatrist and psychologist, and many people confuse the difference between them. What does a child psychiatrist do, and how is this different from the role of a psychologist?
Okay, well, first of all, thank you for having me here. I'm very happy to be here. And to answer your question, a child psychiatrist is a medical doctor, someone who completed his medical training, specialized in psychiatry, and then specialized in child and adolescent psychiatry. They mainly help with diagnosing cases, understanding the symptoms, recommending therapies, and prescribing medications if they are needed. Meanwhile, a psychologist mainly focuses on the therapies and some psychological testing that they do, like IQ assessment and stuff like that.
Children go through different stages of development, and their behaviors may change over time. When should we consider that a child needs professional psychiatric intervention rather than just family advice or guidance?
Okay, well, mainly what we focus on is how the child is interacting with the people around him, whether it's at school or with family or with friends. So if the child's relationships with school or at home is affected, usually we need to intervene then, or when the child's behavior has become or emotional distress becomes detrimental to their ability to go on with their life. So whenever it's impacted, this is when they usually need a psychological assessment or psychiatric assessment. And mainly we focus on children that are withdrawn, overwhelmed, or very aggressive. That's the cases that we usually need to intervene in.
Despite the importance of mental health, some families still hesitate to seek professional help. What are the reasons that make some families reluctant to visit a psychiatrist?
Okay, so there are multiple components. One of the most important ones being common misconceptions, like there's something wrong with the child, or we are blaming the child, or something like stigma, like people saying that it's not good to take your child to a psychiatrist, or something like the child will have to take medications if they go to a psychiatrist, which is not true. So these are reasons, common reasons that make people reluctant to go to a child psychiatrist.
Parents sometimes notice unfamiliar or unusual behaviors in their children. Do all unusual or strange behaviors require a visit to a psychiatrist?
Not at all, because children are developing, they're changing, they're forever changing. They don't remain the same. There are many normal developmental phases, and some behaviors are temporary. So it's okay to stay and wait and not intervene right away. When we see them being intense, persistent, getting worse, that's when we can consider intervention from our side.
Some people automatically associate visiting a psychiatrist with taking medication. Does every child who visits a psychiatrist necessarily need medication?
That's a very important question, and absolutely not. Many children who visit us actually improve with behavioral therapy, with other kinds of therapy, with parental guidance, with many other ways other than medication, okay? And we only prescribe medications when absolutely necessary. This is something very important. And the goal is always the least intervention needed for the child's well-being.
The way we explain things to a child greatly affects how they accept them. How can we tell a child that they're going to see a psychiatrist in a safe and reassuring way that does not cause fear or anxiety?
You know, that's a problem we see a lot in my clinic, because at times the parents bring the children without them even knowing about it, and that makes them scared, not knowing what's going to happen. So it's always important to tell honest, simple, and positive language, such as saying something like, we're going to meet someone who helps children understand their feelings and solves problems, and avoid scary words. Avoid using things like, oh, they're going to give you a needle or stuff like that. That's scary. But be honest with them and tell them that they are not in trouble, that we're all there to help them. And this is something that I do when children come to my clinic. What I always tell them is that I'm here to help you. I'm not on anyone's team. I'm here to help you.
School is not only a place for learning, it is also an important psychological and social environment for children. What is the role of schools in noticing early signs of psychological difficulties among students?
Schools play one of the most vital and important roles in recognizing this, as teachers see the students almost daily. So they can notice important things like changes in their behavior or mood, social withdrawal or peer difficulties, having trouble with other children, and declining academic performance. Early observation and communication with the parents is very, very important and can lead to better results and a better outcome for the patient.
Sometimes we notice signs of sadness or distress in our friends without them saying anything. How can I offer emotional support to a friend who I feel needs help?
That's another excellent question. So what's very important is always understanding that being there really makes a difference. It's always important to be there, listen without judging, show care and concern, and advise them to talk to a trusted adult, as well as not trying to fix everything yourself. Because if you try to fix everything yourself, sometimes you can be overwhelmed.
There are still many misconceptions about mental health in our society. How can we correct the false ideas and misunderstandings associated with psychological treatment?
Well, one of the things that we can do is what we're doing right now exactly, which is talking about it directly and communicating about it frankly, sharing accurate information and not listening to false information, emphasizing that mental health is part of overall health. So if you're a healthy person, your mental health should be healthy as well. And we should also focus on some of the successful stories and share them. Education reduces fear and understanding replaces stigma.
Bullying is one of the issues that can leave a deep emotional impact on a child. How can we recognize that a child is being bullied, and what is the best way to deal with this problem?
Well, that's a very important topic, honestly. Bullying does occur, unfortunately, in a lot of places. So what's important to be vigilant about for teachers to observe and other students to observe is if the person has sudden fear of school, changes in his mood or sleep, withdrawal or loss of confidence, physical complaints without a medical reason. These are all signs of bullying. And what is the best response to it? Listening to the child, not blaming the child who is being bullied, involving the school early, telling the teachers, and supporting the child emotionally. Bullying should never ever be ignored.
Talking to children about death is one of the most difficult parenting challenges. How can we explain the news of a death to a child in a way that suits their age and level of understanding?
Well, that's a very complicated question because children of different ages have a different perception about death. So it's important to focus on talking to the child based on their understanding of death. But what we can say about them all is always use clear language, always avoid vague language like telling them that the person is going to sleep or something that they wouldn't understand, and allowing them to ask questions. It's very important to allow them to ask questions and reassure them that they are loved and cared about, and accept and validate their emotions. Children grieve differently, and all griefs are okay. All reactions to grief are okay.
Some children experience nightmares at different stages of their development. Are nightmares normal for a 2.5-year-old child? And how can we help reduce them?
Well, nightmares in a 2.5-year-old are very, very common. And they do happen. What we can do to help with that is maintain a calm bedtime routine, avoid scary content, don't watch YouTube shorts that are scary, offer comfort and reassurance, and stay consistent and patient. Don't get frustrated for the parents. Try to understand and be there for them consistently. And nightmares usually pass on their own as the child matures emotionally and his imagination matures as well.
Today, we learned that a child is not just behaviors, but feelings, emotions, and messages that need to be understood. Thank you, Dr. Mohammed Al-shamikh, and thank you all for listening. We will meet again in a new episode of Mayaseen podcast. Today, we learned that a child is not just behaviors, but feelings, emotions, and messages that need to be understood. Thank you, Dr. Mohammed Al-shamikh.
Thank you for having me here, Aya and Mayaseen and Marif. I really appreciate this opportunity.